Hello, and welcome to the U.S. Council for Athletes' Health presentation, Athletics in the Era of COVID-19, Vaccination Updates. My name is Dr. Jim Borchers, and I am the president and co-founder of the U.S. Council for Athletes' Health. Our mission as an organization is to collaborate with every athletic organization to inspire and ensure athlete health and safety is a priority. Recently, we have been seeing trends in COVID-19 cases in the United States trending in a positive direction. As you can see from this graph provided by the CDC, we recently, from October through February, have gone through a significant increase in the number of cases of COVID-19 in the United States. Recently, through the second half of February and into the first part of March, we've seen a fortunate decline in the number of cases of COVID-19. This is very encouraging for what we can see in athletics moving forward, as we are now seeing fans being able to return to athletic events and more athletic events being contested without disruption. Along with this good news is a number of vaccinations that are being performed in the United States at this time. We know that there are now 3 approved vaccinations in the United States of America: the Moderna and Pfizer 2-shot series, and the Johnson & Johnson 1-shot vaccination for COVID-19. You can see here that the numbers of individuals being vaccinated has been increasing over the last 2 months in the United States. And you can see here that up to about almost 18% of the population has received 1 or more doses of the vaccination. And about half of those, 9.4%, have received both doses of either the Moderna or Pfizer vaccination. We have a significant number of individuals left to be vaccinated, but with the increased productivity of vaccines, we should see this number continuing to rise. And this again gives us hope that the return to athletics will continue to improve throughout the spring and summer months. Along with this, the CDC has recently released their first update for fully vaccinated individuals, considering both personal and group issues around behaviors associated with COVID-19. It is now recommended that fully vaccinated people can visit with other fully vaccinated people indoors without wearing masks or physical distancing. This means that if you are visiting with someone in your home or in your place of work and both individuals have been vaccinated, you do not require a mask during that time period when you're visiting with that individual. You can also visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing if you've been vaccinated. More importantly for athletes, fully vaccinated people can refrain from quarantine and testing following a known exposure if asymptomatic. This may have wide implications on testing for athletes and disruption from quarantine if an athlete is identified as a high-risk individual. These are all positive indications as we're moving forward with COVID-19 with respect to athletics. The CDC has provided these schematics to illustrate how individuals may interact if they've been vaccinated with those that are either vaccinated or unvaccinated. You can see here again, if you are from a household where you have been vaccinated and visiting with others from another household where they have been vaccinated, you'd need no prevention methods, including masking and social distancing, when interacting with those individuals. If you've been vaccinated, and again, you're interacting with individuals that have been unvaccinated and are at low risk for serious complications from COVID-19, again, you do not need to use any prevention methods such as masking or social distancing when visiting with these individuals. If, on the other hand, you're visiting with someone who's at high risk for COVID-19 illness and the complications it can have, and you've been vaccinated, you still must wear a mask, choose well-ventilated or outdoor areas, be socially distanced, or wash your hands. Again, if you're visiting with individuals from multiple households that have not been vaccinated in the same spot, you should also follow these same prevention methods. The CDC has also addressed vaccinated individuals and their interaction in medium or large size gatherings. The recommendations still state that all people, regardless of vaccination status, should adhere to current guidance to avoid medium or large-sized in-person gatherings and to follow any applicable local guidance restricting the size of gatherings. If an individual who's vaccinated chooses to participate, they should continue to adhere to the prevention measures we just discussed that reduce spread, including wearing a well-fitted mask, maintaining physical distance from others when appropriate, and washing hands frequently. At this point, even if an individual is vaccinated, it does not allow them to not follow those behaviors just mentioned when they're attending a medium or large size gathering, and this would include a sporting event. With respect to other personal or social activities outside the home, we do know that the risk of SARS-CoV-2 infection during public social activities, which could be sporting events or things like dining indoors at a restaurant or going to a public gym, is lower for fully vaccinated people. So if you're vaccinated, the risk to you is lower in these events. However, we want to make certain that we still take precaution, as transmission risk in these settings is higher and likely increases with the number of unvaccinated people present. So very similar to the interaction of individuals that have been vaccinated with household individuals from multiple households that are unvaccinated, those fully vaccinated in these social settings should still follow all the guidance for these settings, including wearing a well-fitted mask, maintaining physical distance, avoiding crowds, avoiding tight, poorly ventilated spaces, and covering coughs and sneezes and washing hands frequently. Again, with respect to fully vaccinated people with COVID-19 symptoms, there is a decreased risk for those individuals having COVID-19, but if any fully vaccinated person has symptoms of COVID-19, they should isolate themselves, be clinically evaluated, and tested for the SARS-CoV-2 virus if it's indicated by their healthcare provider. It's important that even fully vaccinated individuals, if they are symptomatic, consult with their healthcare provider and report their vaccination status at the time of their presentation to care. This may direct the individual for appropriate treatment and testing at the time of their evaluation. If, on the other hand, fully vaccinated individuals do not have COVID-like symptoms following exposure to someone who does have COVID symptoms or has tested positive for COVID, that fully vaccinated individual with no COVID-like symptoms does not need to quarantine or be tested following an exposure to someone with suspected or confirmed COVID-19, as their risk of infection is low. Fully vaccinated people who do not need to quarantine or be tested should still monitor for symptoms for the 14 days following an exposure. And again, if symptoms of COVID-19 occur, should report that to their healthcare provider for appropriate evaluation and testing if indicated. But to reiterate, if someone has been vaccinated and they do not exhibit COVID-like symptoms following an exposure to someone who either has COVID or COVID-like symptoms, they are not required to quarantine or be tested following that exposure if they remain asymptomatic. For the purposes of the guidance we've just discussed, the CDC is considering fully vaccinated individuals for COVID-19 had their vaccination, either the full 2-dose series with Pfizer or Moderna, or the single-dose vaccination with the Johnson & Janssen vaccination. And they must have completed those series and be more than 2 weeks from their vaccination to be considered fully vaccinated and to be able to apply the criteria that we have just discussed regarding quarantining and testing. We do know that these vaccines in the United States are highly effective at protecting vaccinated people against symptomatic and severe COVID-19. Importantly for athletics, there is a growing body of evidence that suggests fully vaccinated people are less likely to have asymptomatic infection and potentially less likely to transmit SARS-CoV-2 to others. And this is due to the evidence that the viral load in someone who's been vaccinated is much lower in that individual than someone who has not been vaccinated. We do still have questions about vaccinated individuals that we need to continue to consider, especially when we're considering athletics. How long vaccine protection lasts and how much vaccines protect against emerging SARS-CoV-2 variants are still under investigation, and we will need to continue to monitor the effectiveness of vaccines, the risk of infectivity with the new SARS-CoV-2 variants that are being identified, and how protective the vaccines are against those variants. Until more is known about vaccination coverage, some prevention measures will continue to be necessary for all people, regardless of vaccination status. And we've discussed that today, especially in those medium and large gathering spaces, or in situations where vaccinated individuals are interacting with unvaccinated individuals from multiple households or a large number of unvaccinated individuals. However, we know the benefits of reducing social isolation and relaxing some measures, such as quarantine requirements, may outweigh the residual risk of fully vaccinated people becoming ill with COVID-19, which we said is very low, or transmitting SARS-CoV-2 to others, which we also believe to be low risk. Therefore, removing those recommendations for quarantine and some of the behaviors that we talked about earlier when interacting with low-risk individuals is reasonable. So, taking steps towards relaxing certain measures for vaccinated persons may help improve COVID-19 vaccine acceptance and uptake. And this is going to be very important when we consider young adults, college-age students, and student athletes considering receiving the COVID-19 vaccine when they are able. If they realize that they will be able to avoid quarantine as a high-risk contact and potentially testing if they remain asymptomatic, it may make them make a more informed decision about whether or not they would be willing to accept the COVID-19 vaccine when it is their turn. Therefore, there are several activities that fully vaccinated people can resume now, and we're seeing some of those being carried out in these recommendations. These activities are at low risk to themselves, and while being mindful of the potential risk of transmitting the virus to others, they can resume these activities safely. So the benefits of vaccination now, what does this mean for athletics? Well, vaccination will allow athletes to participate and compete with decreased risk of contracting the virus and transmitting the virus as well. This could be very important for athletics as we get into the spring and summer months, as we consider the return to athletics of something normal that we knew prior to the pandemic. Vaccination may very well reduce or even eliminate the need for testing prior to athletic events. And testing may move to a clinical testing model where only symptomatic individuals who have been vaccinated would be required to undergo testing. Vaccination may also allow fans to attend events sooner and in larger numbers. And in fact, we are beginning to see that the numbers of fans being allowed to attend sporting events is increasing. As we see infectivity rates decreasing and vaccination rates continuing to increase, fans will be able to attend events sooner, albeit with some behavior modification and hopefully in larger numbers, returning sport to normal. And finally, vaccination may lead to decreased travel restrictions, which will allow for more regular athletics, especially in college and professional athletics and elite amateur athletics. It is worth noting that although the CDC is considering these changes, it has not at this time changed any recommendations for travel, and these recommendations continue to stand despite vaccination status. If you have questions following this update, please do not hesitate to contact us at the U.S. Council for Athletes' Health at info@usca.com. Also, if this topic and other topics around healthcare, safety of athletes, and healthcare administration interest you, please visit our new organization, the Athletic Healthcare Administrators Association. You can also find that on our website. Thank you for joining us today, and we look forward to working with you in the future.